Votta, she's lead nurse today.
Hey guys,
You are?
I'm Brittany, I'm his wife.
Nice to meet you. Why are you here today?
We know Kyle's just been like having a lot of anxiety lately. He can't concentrate in work or at school. He has trouble doing his homework. He gets sent home early from work because he just can't focus. I'm just really worried about him right now.
Yeah, I mean, same thing. It's just like school is it's just kind of building up on me. I mean, I used to get B's, and now I'm getting C's. And finances, just kind of, I need to make sure I make all the payments, and it's just getting me kind of worked up.
How have you handled this before in the past? You've had generalized anxiety disorder for quite some time now, right?
Yeah.
Is there anything that you've been doing for it?
No, not really.
Okay, so what I can do is I will give you a prescription for Xanax. Yeah, go to therapy, exercise.
Oh yeah, this is
Things are
anxiety.
better.
This happens all the time. It's really not a big deal. We have a care plan for anxiety. It's going to tell you boom, 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 exactly what to do. We'll send that home with you. It's totally straightforward. We'll see you back in a few months. You'll be fine. Everybody goes through it.
Huh?
Mhm.
So yeah, that's it.
We'll see you
You'll be
guys in a
okay.
few months.
Everybody goes through it. Okay?
All right. Nice meeting you.
Nice meeting you. We'll see you back in a few months.
Lunch.
Hi, my name is Lauren.
Brittany.
I'm your nurse practitioner today. Kyle, nice to meet you. What brings you here today?
Well, Kyle's just been really anxious lately. He can't concentrate he can't finish a task. He leaves work early because he's so anxious and he just can't focus. I'm really worried about him.
Kyle, what kind of symptoms are you having?
I feel my heart just beating. It feels like it's going to jump out of my chest. I have trouble breathing. It feels like everything is just happening at once, and I can't. It all just kind of comes on me at one time, and it just kind of like just blows up, and I don't even know.
How long have you been having these symptoms, Kyle?
Well, I've had anxiety for a while now, probably a few months, something like that. But now it's getting to a point where it's just getting overwhelming, and it's affecting my life. It's a few weeks now. Yeah.
You've suffered from generalized anxiety disorder, I see, in the past. How have you managed your anxiety and stress in the past?
I would try to stop thinking about it, but every time I would try, it would just come back, and it doesn't really help. There's not really anything I've done other than that. It hasn't really helped.
What stressors are you going through now? Is there something that's exasperating the anxiety? Anything like what's going on at home?
School. School's a major one. I'm in a program right now, and I've been getting B's and things like that, but now I'm dropped down to C's. Financially, I'm trying to make payments on cars and food and house and everything, and just I'm worried that I won't be able to make financial payments.
Mm-hmm.
I would try to study for a test or something, and I would opening the book and try to read, and I can't even concentrate because things are just rushing through my head. And then when I would come to a test, I wouldn't know what I studied, and I think I'm going to bomb the test, and that makes my anxiety even worse.
Okay. Well, you're here today, and what I'd like to do is to work with you, set some goals, to help you manage your anxiety and stress that you're going through. Are you willing to set some goals with me? And
What about like medication or something?
medication is an option, and I can write something for you, but I would also like to focus on some techniques that will help you manage your anxiety, like deep breathing exercises. Exercise is very important. You seem fit. Have you done exercise in the past?
Yeah.
You're not doing any now?
Not as much as I would like to now.
Okay.
No.
I'd like to get you to do some exercising a few times a week to release some natural endorphins that will help manage stress a little better.
Okay.
Some deep breathing, some music, some other techniques. Will you be willing to work with another nurse named Twyla, who's going to come in to see you, and she can teach you some interventions to help you manage this?
Sure.
I'd
That's
also like for you to see a therapist to do some cognitive therapy, if you're willing to do that. Cognitive therapy is sessions from like 5 to 20, depending on the situation, what you're going through, and it'll help you learn some tools to manage better the anxiety that you're going through right now in your life.
Okay.
Is that okay with you?
That's fine.
Okay, so we'll get going on that. It was nice meeting you.
Nice meeting you.
I will see you soon. I'll send Twyla in. Is there anything that I can get you to?
No, we're good. Thank you.
Okay. Hi, Twyla.
Hey, Lauren.
How you doing today?
I'm good. How are you?
Good. Well, I just met with a patient. His name is Kyle. He's 25 years old. He suffers from generalized anxiety disorder.
Mm-hmm.
And he's here today. He's willing and ready to learn some techniques to manage his anxiety.
Okay, good.
I wrote out a quick nursing care plan. He has anxiety related to situational things that are going on in his life. School, he's in a rigorous program, finances. I was thinking that you can teach him some deep breathing techniques
Okay.
and meditation, talk to him about exercise. He seems
Okay.
physical fit guy. He just hasn't been managing
Taking care
it.
of himself. Got
His
it.
he has ineffective coping. He feels like he's going to go out of control. He can't handle everything. So maybe you can get him to do a task list of things that he can manage throughout the day. He's with his wife, Brittany. She's very sweet, and she's also very supportive and wants to help him through this. And
Okay, good.
they're both ready for self-help management and to manage the anxiety. So I think it'll be a big help to them.
Okay, thank you.
Okay, I
Lauren.
appreciate it.
I'm
Have a
gonna
good
go meet
day.
with him now. You too.
Okay.
Hey, Kyle. Hi, Brittany. I'm
Hi.
Twyla. It's
Hey.
nice to meet you.
Nice to meet you too.
Nice meeting you.
All right, I just talked with Lauren, and she wrote up this care plan for you. I printed out a copy for both of you so you can follow along. What we have here are some goals that you have already talked about. The first one is that you can demonstrate 3 techniques that'll help you relieve your anxiety. The first technique is deep breathing.
Okay.
So it looks like you're having a little bit of anxiety right now.
Yeah.
Let's practice the deep breathing and see if that helps at all, okay?
Okay.
Okay, so what we're going to do is breathe in on a count of 4 through your nose, out, count of 4 through your mouth.
Okay.
And we can all do this together. That's it. Ready? How's that feel?
A little bit better.
A little better?
Yeah.
Okay, you look a little better. That's something that you can utilize anytime. Is that something that you'll do when you start to feel anxious?
Yeah, definitely.
Good. Okay, the second thing is going to be meditation. The idea with the meditation is to just get all those thoughts out of your mind. And the best way to do that, I know it's very difficult, it takes some practice, but you can do it. You want to think about things that have a calming effect for you. There's also certain smells and certain sounds that will trigger a calming effect. What I want you to do is find what things work for you and incorporate that into your time of meditation.
Okay.
If you can stay quiet for 3 to 5 minutes and really just close your eyes, put yourself in that place that calms you down, put in a CD or something with the sounds that are going to help you. There's aromatherapy. You can really put yourself in that place. And then the third thing is exercise. Lauren tells me that you used to exercise quite a bit and you
Yeah.
haven't been so much lately.
No.
Okay, can you give me some examples of some exercise that you could do, maybe 20 minutes a day?
I mean, I can run.
I
Things
still
like
love
that.
running.
Yeah.
Okay, that's something you could even do together?
Yeah.
Good.
And with the dog.
Okay. The second goal is that you would demonstrate the ability to deal with your emotional reactions with your anxiety. The interventions, first of all, is to make out a daily list. What you need to do is make a list of all of the things that you would like to accomplish that day. And then start with the smallest, easiest tasks that you can complete fairly quickly. That way you start crossing those things off the list, and by the time you look at your list again, you have half of your things done, and that really encourages you to tackle those things that take a little bit longer. And second is to build in a reward system. So when, you can say, when I accomplish 3 goals, I'm going to reward myself with 10 minutes of something. You fill in the blank, something that works for you.
Okay. I mean, I love playing with my dog, so that'd be good.
And that's perfect. So you can, make your goal whatever you would like. If once I accomplish 3 things on my list, I'm going to go play with my dog for 10 minutes.
Okay.
Okay. And the next thing is to talk to someone. Lauren has contacted a therapist about some cognitive therapy,
Okay.
and you're going to meet with them in a week. And what you're really going to discuss is how these interventions are working for you. The third goal is that you would demonstrate empowerment for your anxiety within 1 week. The interventions for this goal is that you would make a list of affirmations or positive thoughts. We tend to be our own worst critics, so if you have a hard time with this, I would definitely recommend that you utilize Brittany and some friends to help you make the list.
Okay.
And then secondly, I want you to utilize the list. When you start to have those negative thoughts, pull that list out and start just telling yourself all of the good things that are on the list. And then thirdly is medication. Lauren did go ahead and prescribe an anti-anxiety medication for you. It's a low dose and it's a mild anti-anxiety medication.
I would like to use that as a last resort. I'm just afraid that he might become addicted.
That is a common concern, and there is some risks with anti-anxiety medications. There's risk of physical dependence, and what that is after using the medication for a period of time, and it's different with every patient, you could develop a physical dependence where your body just really requires that medication. You have a hard time functioning without it. The other risk for the medication is tolerance. With tolerance, what happens is the medication may not be as effective at that dose anymore, so you have to raise the amount of medication that you take.
Okay.
Brittany is definitely on the right track with her thoughts as using that as a last resort, and that's really what your nurse practitioner has asked you to do as well, is to really go through all of these tools and control your anxiety with all of these things in your care plan. And you're going to meet back with your nurse practitioner in a few months. You're going to be meeting with your therapist every week. So this is something that you're going to want to discuss, how these interventions are working for you. And you're going to want to discuss anything that you would like to change. And if you need to use the medication, she's going to want to know that too.
Okay.
Okay? How does this sound to you? Is this a workable
Yeah.
care plan for you?
I mean, I feel I feel more relieved because now I have at least a set goal, or I have.
Something that he can do
Yeah.
to help him on a daily basis, definitely.
Good. I'm glad that this is going to work out for you. So we will see you here again in a few months, and we will be communicating with your therapist, and we'll be working together as a team to give you the best care.
Thanks.
All right. Nice meeting you.
Nice meeting you too.
You take care.
Me too.
All right, bye-bye.
Thank you.